Welcome, everybody, to Elevate Your Game presents Careers in Healthcare featuring Foremost Health Company. This is a wonderful organization, and we're going to hear from a wonderful person, Mr. Nate Wilson out of Foremost Health, and he is going to share all these opportunities that they have within their organization. And usually usually do some announcements, but Elevate Your Game is just coming off a high right now. We just finished our virtual internship and careers spotlight, where we had dozens of recruiters come on, share their opportunities on internship and early careers, job opportunities, skills building from industry experts, you name it. And one of our special guests, Mr. Nathaniel Wilson, was luckily able to join us for a private session on healthcare careers. We know that the healthcare industry is a huge industry, and we want to make sure that people like yourselves who are interested in the medical field, the healthcare professional field, they can actually get more access. And we don't want to just do a little 10-minute spotlight. We want to share the information, the wealth of information. So let's bring on our special guest, Mr. Nathaniel Wilson. You ready, sir? Here you are.
How are you doing today?
I'm good. Thank you. Thank you for taking the time. Just tell us a little bit about yourself and your organization.
So I appreciate it. Thank you for allowing me to come on and share some information. My name is Nate Wilson. I'm the HR director for Foremost Family Health Centers. The company has been in business for well over 30 years. We offer a variety of different services from family health to OBGYN, as well as dental, behavioral health. We offer 3 locations currently, so we always have opportunity, and we're always growing. We're always looking for quality talent, regardless of what level you are right now and currently into your role. Straight out of college, straight certifications, it does not matter. We're looking for everyone that can come in and be a valuable asset to the community as well as to the patient care.
Well, this is amazing. How long have you been with the organization, and what is the company like?
So I've been with the organization a little bit over 2 years now. This is actually my second stint. I was with the company in 2019 and was there for 6 months and had a family emergency and had to leave. But the love that I have for the company, the CEO and the staff there, and everything that they're doing within the community, it was a dream for me to come back, and an opportunity allotted itself for me to return. And I've been there now for 2 years, a little bit over 2 years. So the company itself, man, I can't speak so much about it. It's everything that you would imagine. We have
Mhm.
a great mission, a great vision, and great values, and everybody that we hire are based on those things there. We look for people that are looking to hold themselves accountable, as well as employ everybody accountable, that has
Mhm.
pride, integrity, and want to put the patients first. That's what Foremost stands for, Foremost Family Health
Mhm.
Centers. So we value that. We are always out in the community. We have an outreach team that's out in the community on a daily basis, speaking about a variety of different initiatives that we offer, as well as the internal candidates that's inside, the ones that are working, hustling and busting on a daily basis. We all know that we just came out of a COVID type of initiative, and still, even with all the layoffs that took place, we still were working and taking care of patients, even if it
Yeah.
was telehealth.
Well, there's a lot of people who, due to COVID, what had happened, they retired
Yep.
earlier, or there was an increased demand of hiring more nurses, more doctors, more healthcare support staff to actually onboard the wake of this huge crisis that was our health crisis that affected us globally. Um, you guys are in 3 locations. Where are those locations at?
We're in the heart of Dallas, Texas. We're right down by Fair Park off of Martin Luther King as an Malcolm X Boulevard. We also have a location in Ball Springs, and we are also in the A Plus Charter School. So we offer a variety of services at majority of these locations. The only service that we don't offer in the Ball Springs location is dental. But outside of that, you can go for family health, PD services, OB services, healthcare, behavioral health services. We have someone on site for that as well. And we're always hiring. We are always looking for quality talent, from a certified medical assistant to a registered dental assistant.
Mhm.
Um, staff physicians, behavioral health managers. Currently, right now, we have open 4 certified medical assistant positions, a couple LVN positions, and a couple of staff and mid-level provider positions.
Excellent, excellent. So let's talk about it. The healthcare industry, as we just mentioned, that they're hiring, you're hiring. What is it? Why is it so important that we have people of color, minorities, multilingual people to be representatives in the healthcare industry?
Diversity is inevitable. It's very necessary and needed. The best thing that you can have is someone that looks like you providing those type of services for you. I think about my wife to this day. She researches thoroughly to make sure that we find somebody of color that will they're going to provide a quality service for us, right? And it sets a high value for that. Even as a male, I think about from a male perspective, there's not a lot of men in human resources. A lot of it, that industry is women driven. We're always looking to be diversified in a variety of different areas. So when it relates to the healthcare industry, it's always great to see somebody that has a sound mindset of what we've been through historically, mentally, health related. They can relate to the things that we deal with. You may not see the same from someone that's from a different race or a different background or a different culture. Prime example is, I grew up with a granny from Alabama. Everything was fried. Well, from somebody that does not have that same ethnicity, background, or culture, it may not be the same. So they're able to talk to me health-related reasons why I should not have all fried foods. And I'm not debating or stating that someone of my ethnicity or background cannot do the same, but it's a relatable prospect for me that helps me.
I love it. I love it. It's very important to understand who you're representing in these neighborhoods for your family health centers. Also have people who are there to support them and can meet them at their greatest need and understand what they're going through in their healthcare needs. I have a background in healthcare and wellness, and I also have a master's in healthcare administration. And one of the reasons why I got that master's because I was dealing with a ailing mother who was in the hospital, and the doctors were literally just prescribing her painkillers and not getting to the root cause of the symptoms. And she was just, a lot of people don't ask the questions or know what to ask or just hear the first information and then just take it as is and don't really challenge it or advocate for themselves or know how to advocate for themselves. And one of the things in her final stages of her life, she was able to get through one part, which was a replacement of a heart valve due to the medications, overpowering her heart valve and an infection. But I was able to verbatim walk in line step with the doctors and the healthcare practitioners to actually reiterate her whole health history.
Right.
And it's very important. And what I found was the system was broken. There's not enough people who were working in the advocacy side. So that's why I went back to school with my wellness background and went into the healthcare side and got into a healthcare administration role. And it was right there at the plight of COVID. I was graduating with my master's. COVID hit. I had an opportunity with Cedars-Sinai Medical Center in Los Angeles, a really big hospital. And they shut down every opportunity for new onboarding because they didn't know how COVID was going to respond.
Of course.
What's happening now with our education system that you see? Why is it important to go back into careers into healthcare? Whatever the career is, whether you're getting a skilled, type of job where you don't need 4 years or 5 years plus of university to just getting like a quick certifications or a license to actually be a tech. What do you think is important? Why do you think it's important to actually go into these fields?
So I think first and foremost, everybody needs to evaluate their situation and come up and brainstorm and come to a plan and conclusion. Why? Because a 4-year degree, and I have a degree myself, but a 4-year degree may not be viable for every individual.
Right.
But in this day and age, there's a variety of certifications that you could gain and accomplish that will allow you to still further yourself in any kind of career path, right?
Mhm.
And that's the same when it comes to the medical profession. For someone who wants to get their foot wet in the medical field, a certified medical position may be just that role for you. It allows you to go and get certified to assist on the front line, and it's
Mhm.
necessary and needed. Um, we are short staffed and short handed. And
Mhm.
as big as the healthcare industry is, it will continue to be that way because for a variety of reasons. It could be uh, COVID. It could be just the passion is lost, just like a teacher. But it's very
Mhm.
important to go back and get that. But it will also allow you to culminate a path for you. For example, for somebody who starts off as a certified medical assistant, maybe they want to go back to school and be a licensed vocational nurse.
Mhm.
It opens the
Mhm.
door for you for a variety of opportunities and compensation growth, right?
Mhm. Mhm.
Next step from there may be a registered nurse. You can go and get your bachelor's of science in nursing and become a registered nurse. But keep in mind, you can become a registered nurse without having a bachelor's degree,
Mhm.
right?
Mhm.
And on to
Mhm.
nurse practitioners. Nurse practitioners make great money.
Oh, yes, they
Physician
do.
assistants make great money. And a
Mhm.
lot of people know these options are not, they don't know that they're viable to them because they have not been educated on the information. So again, I think the best thing you can do for yourself, first and foremost, is evaluate your situation, see what path is best for you. Maybe a certification is the first route to start. I
Yeah.
also don't think that someone should go and bust their pockets and get in debt to go and get a 4-year degree when you can go to a community college first and foremost to knock
Mhm.
out the basic information and foundations and see if
Mm.
that works for you. It is a lot cheaper route to go, and then take those credits, transfer them to the university that you want to attend based on the background that you want to achieve, and go
Mhm.
that route. It will save you a lot of money.
I agree. I also want to stress that it's important to volunteer for the local community hospitals and see how you can do that. You definitely have to adhere to their guidelines and
That's
do a
correct.
background check when you're doing something of that nature, because you are working with people in a very personal level, and you're also working in healthcare, so there might be
Correct.
some vaccinations required to work in healthcare. So let me stress that very clearly. This is not a no vax situation. When you're working in healthcare, you actually have to do the vaccinations because
Mhm.
it's protecting your health and your immune system from others too, who are
That's
very
correct.
sick. You want to also know what you're getting yourself into. To your point, Nate, it's, the healthcare industry can be very expensive to go ahead for those, even if you're just doing certifications. But volunteering is a great way to see how you can volunteer. Are there ways for people to volunteer for your organization?
They are all they, it's a quick process, just like internships. You'll
Hmm.
let us know that you want to volunteer. We're always looking for volunteers for a variety of different things. You may not be in patient care, but believe it or not, there's a variety of positions that you can assist with that still helps with patient care,
Hmm.
i.e., registration, right?
Hmm.
You can learn registration and assist with that matter. Help someone from the front desk to the area where they're being seen by a provider.
Yes.
So there's a
Yes.
lot of different things
Mhm.
that are options for you to be in healthcare. I agree. The volunteering thing is a major piece, and you'd be surprised at what you would get out of the volunteering.
Yeah.
Along again with internships, and if you decide to go to school to have a medical and healthcare background, then look for an externship. We offer both. We offer both at Foremost Family Health Centers. We are always looking to help develop and sharpen individual skills.
Well, let's talk about your onboarding process. Here is the information that you have here. Can you just walk us through this and what the QR codes lead to, real quick?
Yes, definitely. So the one at the top, the light blue one, is to our company's career page. Once you are able to scan that code, it will take you directly to the company's page and allow you to apply to any open positions that we have. We try to keep this as current as much as possible. The one at the bottom that's in the red, black, and white, that one goes to Bamboo HR, which is our HRIS system, our integrated system, services system that we utilize. And you'll be able to apply there as well. We like to give a variety of different options. Either one will get you connected to someone in the HR department or with our talent acquisition and retention specialist, Kim Daniel.
Oh, wow. This is amazing. This is amazing. Is it easy for people to just go through the process, or how long is your onboarding process?
Now, I will be honest. We have been one of my projects have been trying to cut down on the process. It can be kind of strenuous being in the medical field. Why? Because there's a lot of credentialing and backgrounds information that we have to have prior to giving an offer letter. But as soon as
Mhm.
someone applies within 24 to 48 hours, we definitely will connect with you to walk you through the process. We hold your hand through this entire process. We want to make it as streamlined and easy as possible, but everything is also digitalized. So your application process, consent for background check, drug screen is all digital. Everything will be done through a digital signature process, and
Mhm.
actually just emailing documentation that we need to provide for federal regulations.
And speaking of emails, what is the best form of communication for you, to receive any, questions, or how would you want to go about that? If you can just put in the private chat that, what is the best form of communication, and I can post that to our community. And the links are there for Foremost Family Healthcare Centers, and it's amazing. Do you want to leave us with any final words, because you have been very information, so much information. I mean, you're hiring all over. It's not like, oh, we only have one or two roles available. You're actually saying you're constantly hiring,
We are
constantly
constantly
hiring.
hiring, and because we have continuous growth,
Mhm.
and the community that we service isn't getting any smaller; it's growing. So
Mhm.
for that reason, we always are looking for quality talent. Two things that I would leave with you, and again, I really appreciate the time and opportunity here. But
Of
first
course.
thing first is for anybody that's starting in any role that you do, please remember to have a try to have a proactive mindset instead of a reactionary footstep. That's one of the mantras that I live by. Why? Because if we are always thinking ahead, we're not out here trying to put fire bushes and fires out. Two, take it for what it is.
Mm.
Nothing's going to be a walk in the park. Work hard and challenge yourself to be better than what you were the day before.
Mhm.
And have gratitude, show some compassion, have endearment to everybody that you meet. I never meet a stranger. I take something from everybody that I walk across, and you don't know how invaluable that will be to you down the road.
Right. Oh, I just love it. I love it. You have been there's been so much, you know, requests for healthcare, companies to come on and share. We have tons of people who are interested in tech, entertainment, business, finance, and healthcare is always number one. And it is a booming career.
It is.
They're hiring all the time. We're looking forward to having Foremost Health join us for our Dallas Black College Expo, or any of our events that we're hosting in Texas coming up this 23-24 Black College and Latino College Expo season. We'll be traveling to a major city near you, so look out for it. You can also look on our website and find out more information about our internship and career opportunities at www.thecollegeexpo.org/programs/ the movement for opportunities to work within our company. And then also we have opportunities on our website at the bottom with www.ncrfoundation.org. And then if you click on our programs page under the College Expo, you'll find out about our student athlete program. And also for our internships and careers, it's right. You click on the programs page and find their internships and careers program. If you
Great.
have any further questions, you can email me at denise@ncrfoundation.org. And I want to thank you again for joining us. And you can continue to follow us, like us, subscribe to our NCRF TV channel on YouTube, and also follow all the other social media platforms. Again, my name is Mrs. Denise Parker, and I am the Internship and Careers Managing Director for the National College Resources Foundation. And thank you, Foremost Health, for all that you do for our community, for the minority community to making sure they stay healthy and whole in the great state of Texas.
Thank you very much. We appreciate it.
All right, in peace.